my name is Melissa Andrade, and today I'm going to be presenting Leishmaniasis disease, and this is for my community medicine seminar presentation. Leishmaniasis is a parasitic zoonosis caused by protozoans of the genus Leishmania. It is transmitted by insects known as phlebotomine sandflies, which are found in wild and urban environments. The WHO actually considers Leishmaniasis to be one of the most important zoonoses. In 1993, the WHO considered it as the second most important disease caused by a protozoan. Worldwide, up to 12 million people are infected, with 2 million new cases identified annually, and a population of some 350 million people at risk of infection. So how is Leishmania transmitted? The Leishmania parasite is transmitted to humans from a bite from an infected female sandfly. There are over 20 species of sandflies known to transmit the Leishmania parasite. Sandflies become infected when they bite a person or an animal infected with Leishmania. Uncommonly, Leishmaniasis can be passed from person to person through blood transfusions, needles and syringes, and vertically from mother to child. There are many domestic and wild animal species that carry the parasite. These include rodents, foxes, and dogs. Signs and symptoms of Leishmania disease. Not everybody who becomes infected by the Leishmania parasite develops the disease, and many could be asymptomatic. There are 3 different types of clinical Leishmaniasis, which are cutaneous Leishmaniasis, mucosal Leishmaniasis, and visceral Leishmaniasis. Cutaneous Leishmaniasis is the most common type. It mainly infects the structure of the skin, causing skin sores, such as these bumps that you see here. They can also cause nodules and ulcers, as the one seen here. The mucosal form is far less common. It is destruction of the mucosal membranes of the nose, mouth, and throat. It can actually occur as a consequence of cutaneous Leishmaniasis. So the visceral form, also called Kala-Azar, is the most severe form of the disease. It is caused by 3 species of Leishmania: Leishmania donovani, Leishmania infantum, and Leishmania chagassi. It affects internal organs such as the spleen, the liver, lymph nodes, and bone marrow, which is why you see this distended abdomen in this child. You can also see fever, weight loss, and anemia in these patients. Visceral Leishmaniasis, specifically Leishmania infantum, is also known as canine Leishmaniasis. The etiological agent of visceral Leishmaniasis in many areas of the world are dogs, and they're considered the major reservoir host for human Leishmania infections. I include a picture of a foxhound breed because they have recently been found in the United States and Canada to be carrying the Leishmania parasite. Leishmaniasis is treatable and curable, but it requires an immunocompetent system. Human visceral Leishmaniasis has recently emerged as an opportunistic infection among those co-infected with HIV/AIDS and in persons taking immunosuppressive drugs. Leishmania HIV co-infected people have a high chance of developing the full-blown clinical picture of the disease and a high relapse and mortality rate. So individual characteristics that would place somebody at high risk include socioeconomic conditions, and this is because poverty increases the risk for Leishmania. Poor housing and domestic sanitary conditions, such as a lack of waste management or open sewage, may increase sandfly breeding and resting sites. Human behavior, such as sleeping on the ground or outside, may increase the risk as well. Malnutrition is another individual characteristic that places somebody at a high risk, and this is because diets lacking protein, energy, iron, vitamin A, and zinc increase the risk that an infection could produce a full-blown picture of disease if infected with Leishmania. Behavioral issues are also another important individual characteristic, and this is because lack of awareness in endemic regions can lead to a lack of care taken by people with their own pets at home that may be infected, and a lack of caution with sandflies outside. So there is actually a lot of endemic regions that have no routine testing for Leishmania, which is another factor. So population characteristics that contribute to the prevalence of Leishmania. Population mobility is a big one. Epidemics of both cutaneous and visceral Leishmaniasis are often associated with migration and movement of non-immune people into areas with existing transmission cycles. Environmental changes also play a role. The incidence of leishmaniasis can be affected by changes in urbanization and the human insertion into forested areas. Climate change, leishmaniasis is climate sensitive, and it affects the epidemiology in several ways. Changes in temperature, rainfall, and humidity have strong effects on vectors and reservoir hosts by altering their distribution and influencing their survival and population sizes. Small fluctuations in temperature can have a profound effect on the developmental cycle of Leishmania infected sandflies, allowing transmission of the parasite in areas not previously endemic for the disease. Leishmaniasis is difficult to control, thus making it an important public health problem. I included a picture here of my fur baby just because when I first learned that dogs are considered a major reservoir host for human Leishmania infections, that became so concerning to me because I do travel a lot with my fur baby. And a lot of people are not aware that Leishmaniasis is actually something that they are at risk for, which makes you at risk for it as well. These are images of puppies that actually do have Leishmaniasis, and you can see the skin sores on them. This is a better look at them. They just look so painful, and I wouldn't want that to happen to my fur baby. So what can be done globally or at the population level to help prevention and control of Leishmaniasis? It requires a combination of interventions and strategies because transmission occurs in complex biological system involving the human and animal reservoir host, the parasite, and the sandfly vector. So key strategies for prevention are early diagnosis and effective treatment. This reduces the prevalence of the disease and prevents disabilities and death. It helps to reduce transmission and to monitor the spread and burden of disease. An excellent example of this is in Brazil. Leishmaniasis is endemic in Brazil. Dogs are the target for control programs in Brazil, where approximately 3,500 human cases of zoonotic visceral leishmaniasis is reported each year. The Ministry of Health oversees a program of serologically testing dogs and isolating positive animals. A major concern is the extension of traditional endemic areas for leishmaniasis infection, which is now reported in Northern European countries and North America. Vector control is very important as it helps reduce or interrupt transmission of disease by decreasing the number of sandflies. Control methods include insecticide spray, use of insecticide-treated nets, environmental management, and personal protection. Next is effective disease surveillance. It is important to promptly monitor and act during epidemics and situations with high case fatality rates under treatment. Control of animal reservoir hosts is also another way to prevent and control leishmaniasis. It is complex and should be tailored to the local situation. Leishmaniasis prevalence in non-endemic areas is associated directly with the increased mobility of pet travel across borders. Control at this level could be a major way for leishmaniasis to be controlled and prevented. Pet travel has been responsible for the establishment of reservoirs of Leishmania infected dogs in non-endemic regions. The focus of attention for health certificates when traveling is rabies. This is where I bring in Australia. Australia actually requires, if you're bringing your pet into their country, they require testing for monocytic ehrlichiosis, brucellosis, leishmaniasis, and leptospirosis. So at a population level, supporting national leishmaniasis control programs technically and financially to produce updated guidelines in countries and make disease control plans, including sustainable effective surveillance systems and epidemic preparedness and response systems, is another great way to ensure control and prevention of leishmaniasis. Monitoring disease trends is also very important. This will allow raising awareness and advocacy on the global burden of leishmaniasis and promote equitable access to health services. So what can be done locally? Following the WHO Control of Leishmaniasis Case Management Guide from 2014, they actually make recommendations in their guide on how to approach a case if it does arise of leishmaniasis. So firstly, you must diagnose. The WHO makes it mandatory to obtain a parasitological confirmation of the diagnosis before engaging in treatment. So this is confirming the diagnosis by seeing the parasite in the laboratory. Effective prompt treatment is the next step if a person is diagnosed with leishmaniasis. The treatment of leishmaniasis depends on several factors, including what type of disease the person has, concomitant pathologies, the parasite species, and the geographical location. Antihelminthic drugs are available, and a specific guide is shown in the WHO guide. Next is monitoring and evaluation. These are the indicators used in evaluating case management of cutaneous leishmaniasis. So first, you have to look at the size of the lesion, the number of lesions, the location of lesions, the number of months between onset of symptoms and diagnosis, the severity of the disease, the cure rate, the complication rate, treatment failure rate, relapse rate, and parasitological confirmation. So this is actually stuff that you would report to your local health systems. So this is a concept map that kind of brings everything together, or at least I hope it does. Leishmaniasis disease, these are everybody who's at risk or most at risk and ways to kind of control that. Diagnosis, which is established with history and physical, the laboratory confirmation and reporting to your local health department, the 3 different types of disease, and then the treatment, the antihelminthic medications. So thank you so much for listening. These are my citations, and this is one that I wanted to kind of highlight. This is the case management and treatment guide at WHO. It goes into things a little bit more in detail, and you're free to take a look at that if you are interested.